Most people think a stroke looks like a dramatic collapse in a movie, a person clutching their head, falling to the ground, or crying out in pain. In reality, in my 30 years in the ER, I've seen that a stroke usually looks like a man sitting in his favorite recliner, wondering why his left hand feels slightly heavy, or why the television screen looks a bit blurry, and deciding to take a long nap to see if it goes away. That nap is often the last time that man will ever walk unassisted. In the medical world, we have a saying, "Call Tom his brain." It sounds like a catchy slogan, but it is a cold, biological fact. Every single minute that a blood clot sits in a major artery in your brain, you lose about 1.9 million neurons. That is 2 million memories, 2 million connections to your hands, your legs, and your voice, vanishing every 60 seconds. I'm Dr. Robert Harrison. I've spent my career on the front lines of emergency medicine, and I've had to have the heartbreak conversation with thousands of families, explaining that because they waited just 2 hours too long to call for help, the window for the medications that could have reversed the damage has slammed shut. The most dangerous thing you can be during a stroke is polite. I've seen so many seniors lose their independence because they didn't want to make a fuss or bother the paramedics on a Sunday morning. Today, I am going to give you a new set of rules. I'm going to show you why the standard BEFAST acronym isn't enough anymore, and I'm going to reveal the logistics secret that explains why driving yourself to the hospital is actually the slowest way to get treated. By the end of this video, you will know exactly how to spot a quiet stroke, and you'll have a clear 3-step protocol that acts like a VIP pass, skipping the ER waiting room and getting you straight to the specialists who can save your life. Before we go further, I want to ask you a very honest question. Have you ever had a weird symptom, maybe a numb foot, a dizzy spell, or a moment where you couldn't find a simple word, and decided to wait an hour just to see if it went away? Be honest, we've all done it. Write yes or no in the comments right now. I want to see how many of us have fallen into that wait and see trap. Let me tell you about Leo. Leo is 72, a retired high school principal from Des Moines, Iowa. He's the kind of man who keeps his lawn perfect and never misses a Saturday morning at the hardware store. Last Tuesday, Leo was in his kitchen pouring a cup of coffee when his hand felt clumsy. He dropped his favorite mug. It didn't shatter, but the coffee splashed everywhere. Leo didn't feel any pain. He didn't feel sick. He just felt a little embarrassed. He thought, my arthritis must be flaring up, or I'm just getting old. He cleaned up the mess, sat down in his chair, and decided to wait for his wife to get home from the grocery store before mentioning it. He didn't want to worry her. He didn't want to be a burden. When his wife, Sarah, walked in 45 minutes later, she noticed the left side of Leo's mouth was slightly lower than the right. When he tried to say, the grocery store must have been busy, it came out as, the Grocery Tor busy. Now, Sarah knew something was wrong. But even then, they made a mistake that almost cost Leo his ability to walk. Instead of calling 911, Sarah helped Leo into the car and drove him to the hospital herself. She thought she was being faster. She thought she was saving the ambulance for someone who really needed it. By the time they navigated traffic, found a parking spot, walked into the ER, and waited at the triage desk, 2.5 hours had passed since Leo dropped that coffee mug. In the brain, 2.5 hours is an eternity. When Leo finally reached me in the treatment bay, he had already lost nearly 300 million neurons. We were working against a ticking clock. In the ER, we have a golden window of about 4.5 hours. That is the deadline for us to use powerful clot-busting medications, what we call thrombolytics, that can literally dissolve the blockage and restore blood flow. If you miss that window, the risk of brain bleeding becomes too high, and we often have to tell the family, "I'm sorry, but our hands are tied." Leo was lucky. He made it with 90 minutes to spare. But the recovery he's facing now, months of physical therapy just to use a fork again, could have been avoided if they had known what a stroke actually looks like in the first 5 minutes. You see, most people are taught the BEFAST acronym: face drooping, arm weakness, speech difficulty, time to call 911. It's a good start, but as a doctor, I can tell you it misses about 14% of strokes, the quiet ones that happen in the back of the brain. That's why I want you to learn the upgraded version, BEFAST. The B stands for balance. I once treated a woman named Doris in Savannah, Georgia. She was 66 and was out watering her hydrangeas when she suddenly felt like she was standing on the deck of a rocking boat. She didn't have a headache. Her face wasn't drooping. She just couldn't walk in a straight line. She thought it was the Georgia heat. It wasn't. It was a stroke in her cerebellum, the part of the brain that controls coordination. The E stands for eyes. This is what happened to Clarence, a 70-year-old birdwatcher in Bend, Oregon. He was looking through his binoculars when the left side of his vision simply went dark, like a gray curtain had been pulled halfway across his eye. It didn't hurt. He actually thought he had a smudge on his lens. Sudden loss of vision, or even double vision, is a massive red flag that your brain isn't getting the blood it needs. When you add face, arm, and speech, you become much more likely to catch a stroke before it's too late. But recognizing the signs is only half the battle. The other half is how you react. And this is where most people, even well-meaning spouses like Sarah, get it wrong. They think the car is faster than the ambulance. I'm going to tell you exactly why that logic is a medical trap and what you need to say the moment the 911 operator picks up the phone. When you decide to drive yourself or have your spouse drive you to the hospital, you are making a logical but devastating assumption. You assume that arriving at the physical building is the finish line. But here is what most people miss. When you walk through the sliding glass doors of an emergency room, no matter how much your spouse insists it is an emergency, you enter a system designed to categorize, process, and wait. You are handed a clipboard. You sit in a plastic chair. You wait for the triage nurse to call your name. Now, this is where things change completely. When you dial 911 and say the words, "I think my husband is having a stroke," you don't just get a ride. You activate what we call the stroke network, and The paramedics run a structured neurological assessment right in your living room. If they suspect a stroke, they pick up a radio and call my emergency department directly. We call this pre-notification. Before you are even loaded into the back of the ambulance, I have cleared the CT scanner. The neurologist on call is paged. The specialized stroke team is literally standing in the ambulance bay waiting for your arrival. We bypass the waiting room entirely. In stroke medicine, we measure something called door-to-needle time, the exact number of minutes between you entering the hospital doors and receiving life-saving, clot-busting medication. Arriving by ambulance with a pre-notified team shaves critical brain-saving minutes off that clock. It is a VIP fast track to survival. Let me explain the biology of what is actually happening in your brain during those wasted hours in a car or a waiting room, and why that 4.5-hour golden window is so unforgiving. Think of the arteries in your brain like a network of high-pressure hoses watering a delicate, complex garden. A stroke is a boulder suddenly blocking the main hose. The garden, your neurons, starts drying up and dying immediately. The medical therapy we use, known as a thrombolytic, acts like a highly potent solvent that can dissolve that boulder and instantly restore the flow of water. But here is the absolute catch. If that boulder blocks the blood supply for too long, the walls of the blood vessels themselves begin to break down, weaken, and rot. If we give you the powerful clot-busting medication after 4.5 hours have passed, the sudden, intense rush of high-pressure blood will burst right through those damaged vessel walls. This causes a massive, often fatal hemorrhage inside your brain. That is why the time window is completely non-negotiable. If you wait 5 hours in your recliner to see if your heavy arm gets better, my hands are legally and medically tied. I cannot give you the one drug that could give you your absolute best chance at walking out of the hospital with your independence intact. And that brings us to the part that matters most, the ultimate trap that catches so many smart, capable seniors. What if you wait and the symptom actually does go away? This is known as a transient ischemic attack, or a TIA. You might have heard it called a mini-stroke. I prefer to call it the final warning. I want you to think about Elena, a 69-year-old retired librarian living in Mesa, Arizona. Elena was sitting on her living room floor, reading a bedtime story to her grandson. Suddenly, the words on the page looked like complete gibberish. She tried to call out to her daughter, but the words came out sounding like she had a mouthful of marbles. Elena was terrified. But 10 minutes later, her vision cleared perfectly. Her speech returned to normal. Because she felt completely fine, and because she didn't want to ruin her grandson's evening, she chalked it up to being exhausted and simply went to sleep. 2 days later, Elena suffered a massive, debilitating stroke that permanently stripped away her ability to speak and left her right side paralyzed. The simple mechanism here is vital to understand. A TIA means a dangerous blood clot temporarily blocked an artery in your brain, but your body's natural blood pressure managed to push it out of the way or break it up just enough to restore the flow. The symptom disappears. You feel a massive wave of relief. But the underlying factor that produced that clot, whether it's an irregular heartbeat like atrial fibrillation or a buildup of unstable plaque in your carotid artery, is still actively pumping out more clots. A TIA is not a sign that you dodged a bullet and are safe. It is a blaring physiological siren that a much larger, permanent clot is on the way, often within 48 hours. Which of these scenarios sounds most like you? Have you ever had a strange physical sensation and brushed it off simply because it stopped a few minutes later? If you ever experience a symptom of a stroke, even if it completely vanishes after 5 minutes, you still go to the emergency room immediately. You do not go to sleep. You do not wait until morning. To protect yourself proactively, I want you to take control at your very next routine doctor's appointment. Ask your doctor this exact question. Based on my blood pressure, my heart rhythm, and my current medications, what is my personal risk for a stroke? I sen incurren sense al kursurg. And is there anything in my chart that would prevent me from safely receiving clot-busting medication in an emergency? Bring this specific concern to your pharmacist as well. Ask them to review your file to ensure none of your daily supplements or prescriptions interact negatively with standard emergency stroke protocols. Now, we need to talk about the psychological elephant in the room. The real reason you might hesitate to call 911 isn't just a lack of medical knowledge, it's pride. It's the deep, ingrained fear of being a burden. It's the dread of the ambulance sirens waking up the neighbors, only for the doctors to tell you it was just a pinched nerve or a strange migraine. Let me show you exactly how to reprogram that fear and give you the final, practical checklist that will guarantee you know exactly what to do when the moment strikes. In my practice, I've noticed that this hesitation almost always comes from the exact same place. If you are in your 60s, 70s, or 80s, you likely grew up in an era where toughness was a virtue. You were taught that you don't go to the hospital unless you have a broken bone or a bleeding wound. You were taught to handle things quietly. I deeply respect that resilience. But I need you to understand that when it comes to the complex plumbing of the human brain, toughing it out is biologically impossible. You cannot willpower your way through a blood clot. I often have to be very blunt with my patients, and I'm going to be blunt with you right now. The fear of being a burden by calling an ambulance is an illusion. Do you know what actually makes someone a burden? Ignoring a symptom for 3 hours, suffering a massive, irreversible stroke, and forcing your spouse or your adult children to become your full-time, round-the-clock caregivers for the rest of your life. Calling 911 isn't an act of panic. It is the ultimate act of taking responsibility for your own independence. Emergency room doctors are never, ever annoyed by a false alarm. If you come in by ambulance, we run the scans, and it turns out to just be a complex migraine or a pinched nerve, I will happily shake your hand, discharge you, and send you home to sleep in your own bed. We celebrate false alarms. We mourn missed windows. So, here is your non-negotiable 3-step protocol. If you or your spouse experience a sudden loss of balance, a change in eyesight, a drooping face, a weak arm, or slurred speech, this is exactly what you do. Step 1. Look at the clock immediately. In the emergency room, the most important piece of information you can give me is called the last known normal. If your husband was fine at 9 a.m. and you noticed his speech was slurred at 9:15 a.m., his last known normal is 9 a.m. That is the exact moment my 4.5-hour countdown clock begins. Step 2. Dial 911 and use this exact phrase. I suspect a stroke, and the last known normal time was. When the dispatcher hears that phrase, they immediately upgrade the priority of the call and start notifying my hospital before the ambulance even reaches your driveway. Step 3. Do absolutely nothing else. Do not give them a glass of water. Do not let them lie down and close their eyes. And whatever you do not give them an aspirin. If they are having a hemorrhagic stroke, meaning a blood vessel has burst rather than blocked, an aspirin will thin their blood and make the bleeding catastrophic. You unlock the front door, you gather their list of daily medications, and you wait for the paramedics to walk in. I want to take you back to Leo, the retired principal from Des Moines, who dropped his coffee mug and decided to wait for his wife to come home. Leo is still alive today. But because he and Sarah chose to drive to the hospital, he missed the optimal window for a full recovery. He spent 3 weeks in an inpatient rehabilitation ward. He had to sell his beautiful 2-story home because he can no longer safely climb the stairs. He uses a walker and his speech is still slightly delayed. He is fighting hard, and I am proud of his progress. But it breaks my heart knowing that if Sarah had picked up the phone and dialed 911 the second she walked through the door and heard him slurring his words, Leo would have been fast-tracked through my ER doors. He would have received the clot-busting medication with hours to spare, and he would almost certainly still be mowing his own perfect lawn today. My mission on this channel isn't to frighten you. My goal is to equip you with the exact medical truths that keep you out of my emergency department and safely in your own home, living life entirely on your own terms. Aging doesn't mean losing control, it just means you need a smarter strategy. I want to see who is actually going to take this strategy and apply it. I want you to go down to the comments right now and make a commitment. Comment fast track if you promise to never drive yourself to the hospital during a suspected stroke. Comment BEFAST if you are going to write down the upgraded warning signs and put them on your refrigerator today. Or comment share if you've already copied the link to this video and sent it to the most stubborn person in your family. Please hit the share button and send this to your friends, your siblings, and your community groups. Save this video to a playlist so you can review it later. And if you want more plain-spoken, medically sound advice that protects your independence, hit the subscribe button. I'm Dr. Robert Harrison. Protect your brain, protect your independence, and I will see you in the next video.